In my life, there came some time when I had to make a choice. You know, the things just weren't right. I looked around for someone else to blame. I searched and I searched and I reached out inside. And I knew when I found there's a light I can hide. I can be free. I can be free. I can rise above. I can be free. Good afternoon, everybody. This is Dr. Duncan McCollum, and this is KSCO Radio. I'm very happy to be here today on a nice, gloomy day in Santa Cruz. It's actually awesome. I love the nice rainy weather, and driving along the beach today was really neat. So I have a guest on today. I haven't had a guest in quite a while, and the guest I have is a good friend of mine, also an expert in peripheral neuropathy. In fact, Dr. Dan McClimon is the gentleman that introduced me to the technology that we are using in our office to get astounding results with peripheral neuropathy. Now, what's really amazing is we know that the peripheral nerves, when they lose oxygen, they start to lose their functionality, functionability, and they start to die. And you start to have a lot of symptoms. But the one thing that Dr. Dan McClimon has put together is a myriad of techniques that actually will help regenerate the nerves. And I'm going to go over that. He'll be on the show with us in probably about 15 or 20 minutes. And he's going to give his expertise. He's going to talk about two things that people overlook when it comes to peripheral neuropathy. And it's going to be very important if you do have peripheral neuropathy to pay attention, because this is the key. The thing about peripheral neuropathy is it will basically own you. It will have a huge impact on your life, and it will usually you get it in the later years of your life. And that for most people means you've gone to school, worked hard, got a good education, worked hard, put away for the future. Now you're potentially got your retirement, but you're housebound because you're afraid to walk on uneven pavement. You don't like to have the blankets on your feet at night, all these various things that we'll go into. So I'm going to start off the show until Dr. Dan gets on, talking about a letter that basically represents the patients that we get with peripheral neuropathy. And the letter says, "My dear friend, I'm not really sure when I first noticed it, nor what it was I did notice. All I remember is that one day there was this feeling of foreboding over me, kind of like I was doomed. At first, it would just fade in and out, and I wasn't really sure. Well, I didn't want to believe it was really there. I think I was trying to will it away. It didn't work. That was 3 years ago, and now it seems my worst dreams have come true. Now it's with me every day, when I wake up, or even when I sleep, if I do. I spend a few minutes taking stock every morning, hoping that it might have magically gone away." Well, that's what I did at first for a while, but now it's part of me every day. And it's just not going away. So one of the things about peripheral neuropathy is it just has this insidious onset with one or two symptoms that goes into a myriad of symptoms, and then it escalates into a problem. Now, we actually have made incredible inroads on helping people much quicker than I thought we would. When Dr. Dan introduced us to all these techniques that we put together. I was hoping for the best, but, in 90% of the cases, we're getting incredible results. So I'm going to just go through a list that I have here of neuropathy assessment survey. So if you're listening and if you know anybody that has any of these, then listen to the show. It will be available. You can always contact my office to get more information on it, but there's 25 questions. This is a neuropathic assessment that Dr. McClimon put together for me. It says, number 1, trouble walking or you're walking slower. Balance issues are a concern. Difficulty on stairs, trouble falling asleep or staying asleep, burning or freezing feet, pins, needles, pain, numbness, swelling, fatigue, heaviness, difficulty driving and feeling the pedals. I hear this from a lot of people that they're having trouble feeling the pedals and they're afraid because not only they're not sure where their foot is, but if somebody and when their family finds out about this, they might lose their freedom of driving, and it's a scary thing. And most of the solutions out there aren't solutions. Most of them are medications that cover up the symptoms, but never get to the upstream cause of the problem. And that's what we have been able to work with. We have a lot of success stories within the first few weeks of amazing change, which was startling to me, considering that most of the treatment out there is of medications like gabapentin, which is an off-label drug for epileptic seizures. In other words, you medicate the symptoms until, that medication doesn't work, and then you go from there. So difficulty feeling the gas pedals or brake pedals, tightness or saran wrap feeling around the legs. I hear that a lot. Another one is a spongy or marshmallow feeling, bunching of the socks under the feet. And this all adds up to a loss of independence and unable to enjoy the outdoors, gardening, and yard work. A lot of people, you work your life away and then you want to just go garden and you can't because you're afraid you're going to fall. And we've seen many of our patients that have had that bad experience, not knowing there's a solution to this. Now, I'm going to just let you know that right now, Mariah is at the office and we are offering a complimentary consultation, a neuropathic assessment, and a thermographic images of your hands and feet. This is going to assess whether or not you are losing oxygen to the extremities. Oxygen keeps the nerve alive. Without oxygen, everything dies, right? So you're able to do that. The number is 831-459-9990. Before Dr. McClimon gets on, I just wanted to go over that with you. He will talk about it more. So the other thing is the loss of independence and unable to enjoy the outdoors, gardening, or yard work. So I went over that already. You don't get out with the family or friends much anymore. You just kind of feel like, I don't want to impose on people. I don't want to look awkward. And, there is hope. I'm telling you, we're seeing amazing results. You owe it to yourself to come in and see if we can help you. Mariah's there at the office right now, 831-459-9990. Get a pencil and paper because I'll repeat the number again along the way, but it's 831-459-9990. Now we have a limited number of appointments that you can call in today to get in this coming week. And you will come in, we'll make sure you have the neuropathic assessment filled out. We'll go over that. We'll take the thermographic imaging, which are gonna give us an idea how bad the neuropathy potential is. And then if it makes sense, we can go further from there with another set of tests that are standard for the industry of neuropathy. But first, we want to find out if it looks like something we can help, because I really hope we can. Loss of independence, unable to enjoy the outdoors, don't get with your family, difficulty playing with your grandkids, getting up and down. This is a terrible thing that happens. You're not able to attend the kids' events or your grandkids' events because of the football fields have gopher holes in them, and you don't want to risk hurting yourself or being an imposition. Going to sports or even graduations, people start to become reclusive when they are afraid to go out. This is the signs of peripheral neuropathy. There is hope. We're getting amazing results. Dr. Dan McClimon will be on at the bottom of the hour, and you want to listen to him. This guy has pioneered putting together, he's worked with doctors from MIT, making sure that we understand nutritional values to get the blood and oxygen down to the tips of the toes and fingers, also to the organs that can be affected by peripheral neuropathy. And I'll go into that a little bit more in a minute. But difficulty traveling, yeah, you don't want to go on vacations anymore. You've worked all these years thinking that someday you're going to go walk on cobblestone streets in Italy or something, right? And you just don't think you can do it. I have a patient that would love to go on a trip. She had it planned for years, and right now she doesn't think she can go because of the peripheral neuropathy. She has 60% loss of nerve function in one of her feet. This is something we see changes, and if we can change it, great. It's worth a try for you. No charge. Okay, if you got your pencil and paper, I'm going to go through the number again. It's 831-459-9990. We're right here in Capitola by Trader Joe's, the heart of Capitola. Other things: difficulty walking on the beach, trails, camping, and uneven surfaces. So we live in a Santa Cruz. Hey, Stevie, we live in a beach town here, and people love to walk on the beach right now with all these incredible waves happening. There's so many beachcombers out there wanting to have a good time. But if you're afraid to walk because of uneven surfaces, then you're going to have problems getting out. Maybe walking your dog. I've had patients come in when the dogs tugged them, and because of the loss of balance between the feet and the brain, the inner ear, they've had injuries from that. Those injuries can be really devastating. So it's better to handle the problem before it gets worse. Trouble riding in the car, sitting for a while. Of course, motorcycles on longer trips sound completely out of the question. When you can't feel your feet, you don't know when you're putting your feet on the ground, changing gears and all that. And even if you are not one to get out, a lot of times it's trouble entertaining, cooking, cleaning, being on your feet. You're afraid you're going to fall. And this is another thing that we've seen incredible results with. And I know I'm really presenting this today in a way that I'm really describing that you get on here. Dr. Dan is let me know he's on the way. But we really want to make sure that we are going to give you hope. And your life is, you've gotten this far, you might as well get yourself in the best shape you can moving forward. Again, falls and complications of falls are terrible. So, you can prevent these by making sure that you do this in time. A lot of people, the 6 most famous words in my office, I hear them. In fact, it's on the wall in my waiting room and in my exam room. It says, "I thought it would go away. I thought it would go away." Those are the most often heard in any hospital, any doctor's office, any chiropractor's office. I thought it would go away. Peripheral neuropathy doesn't get better on its own. You can medicate it and dull the signs and symptoms. But listen, I'm out right now with a very, very big message to you. You can handle this. 90% of the people get great results, and I'm sure you're one of them. But you don't know unless you try. Yeah, walking on the creek trails up in Nising Marks. That's correct. So loss of aspirations to be active. You're going to be more sedentary, sitting on the couch, playing crossword puzzles or reading books or watching your favorite show, which isn't bad, but life is to get out and live. Life is to be lived. And if your body's keeping you prisoner, then this could be very helpful for you. I'm going to give you my number again, Mariah's there at the office right now, and we have so many, only a certain amount of new patients we can take next week. And we're going to do a complimentary consultation, a neuropathic questionnaire, and we're going to take thermo imaging of your hands and feet. And these are going to let us know what the blood supply is to the nerves at the tips of your fingers and toes, because nothing lives without oxygen. Lack of oxygen to the heart is a heart attack. Lack of oxygen to the brain is a stroke. Lack of oxygen to your fingers and your toes is peripheral neuropathy. All of this leads to problems, okay? And some more quickly than others, but the slower one is the problem. And that's, the ones that we can help you with. So you're unable to enjoy life and your retirement that you had imagined. Bottom line, what do you want to do this year? What is your goals? What have you been wanting to do in your life that you're unable to do? So there's a mental and an emotional impact, the fear and anxiety, the frustration, the worry, the depression, and becoming a burden to your family. So that's why I'm on here today. If I hadn't gotten such amazing results, I wouldn't be passionate about this, but I am passionate because we are getting them, and you can come into our office and find out if we can help you. So this show will be up on my webpage, which is my YouTube channel, Dr. Duncan McCollum, and there is going to be one of those weird QR codes that you can take a picture of with your phone, and you will get access to the neuropathic assessment survey, as well as an opportunity to come into our office. However, if you just call Mariah right now, 831-459-9990, she'll get you in. Now, this is the first time I've ever been having a live person at the office taking the calls, because I don't want you to waste another day. I thought it would go away. That's a really good wish. There are 25 million people diagnosed with peripheral neuropathy. So let me just explain the word peripheral means outside of the body. So you have your house. Inside your house would be the central nervous system. As soon as you walk outside the door, that's your garden. It's the periphery of your house, the periphery of your property. Any nerve, once it exits the spine or leaves your house, is a peripheral nerve. And 25 million Americans have been diagnosed with peripheral neuropathy. Now, to be diagnosed with that means that it's been going on for a long time, to where you go to the doctor complaining of these, and they tell you you have peripheral neuropathy. We'll go into some of the causes in a minute, but if 25 million people have been diagnosed in the United States, millions and millions and millions more have not. They don't have a clue. They have the beginning signs of it, and they just are hoping that it will go away. So you have 31 pairs of spinal nerves that leave your spine and go into the periphery. So you have 31 doors on each side of your spine where the nerves come out and become the peripheral nerves. So that's 62 altogether. They go to 75 trillion cells. You also have some nerves in your brain, 12 of them called cranial nerves. The vagus nerve, which controls your parasympathetic and sympathetic nervous system, your autonomic nervous system. You may have heard of that, the vagus nerve. That controls, make sure your heart beats and your lungs lung and your liver livers. So you can have neuropathies of those nerves as well. So what is peripheral neuropathy? Again, peripheral is outside or around. Neuropathy is a problem with a nerve, a pathology with a nerve. Anything that damages the nerves of the body. It can give a wrong signal, it can give a partial communication, or it can be cut completely. Every nerve in your periphery has a specific job. Sensory nerves, those are touch. They receive sensation, temperature, pain, vibration, touch of the skin. The motor nerves, of course, control your muscle movement. And then you have the autonomic nerves, those that control the functions such as blood pressure, sweat, heart rate, digestion, bladder function. Bladder function can be a peripheral neuropathy if you're having trouble with that. So much attention is given to treating the symptoms, but so little is given towards figuring out why it's going wrong in the first place. So that's what we do. So in a couple more minutes, Dr. Dan McClimon will be on here, and he is the expert in the area in the country. He works with many doctors, and through his teachings and understandings and the program he put together, thousands and thousands and thousands of people have been helped with handling peripheral neuropathy. So if you are listening and you want to take advantage of the opportunity to come in for a complimentary consultation, we can only do so many this week. Mariah's on the phone, 831-459-9990. And we would love to have you. Also, if you just go to Dr. Duncan McCollum YouTube channel within a couple of days, this whole show will be up, recorded live. You can see me visually, and there are those funny codes called QR codes that you can use to get access to our office. But don't wait. That's the worst thing that you can do. Pain and tingling in your feet is one of the biggest ways it starts. Burning, itching in the skin or the hands or the feet. I've gone over a huge list of complications with peripheral neuropathy. And some of the causes, the number one cause probably is diabetes. And 60% of people in the United States are diabetic or pre-diabetic, 60%. And 30 to 40% of them will develop peripheral neuropathy. If you've got family members or you yourself have got numbness and tingling in your feet, or you might know people that have had to have things taken off because they've gotten so bad that the nerve, the blood supply to the nerves in the feet have gotten to a point where the tissue is dying. And this is necrosis, and necrosis means it's dead. And these are the things that specifically with diabetes mellitus are a major problem. So you may be doing some things to mediate your diabetes, but if you aren't keeping the blood and oxygen to your toes and fingers functioning, you might consider calling my office and letting us assess what they look like. Chemotherapy. Cancer is the second leading cause of death in the United States right now. Chemotherapy is it's huge it's so toxic that might be put into the body to address a cancer in an area, but that chemo, those chemicals, let's call them what they are, chemicals and poisons, are going to try to poison that cancer cell before it poisons you. They damage the delicate tissues at the end of your fingers and your hands and in the end of the nerves going to the organs. So chemotherapy is a huge cause of peripheral neuropathy, which can be reversed if we catch it in time. Globally, 57% of the cancers, 17 million people required chemotherapy in 2018. And 53% of them would need chemotherapy. Radiation, if didn't need chemo, but you've had radiation, 50% of all cancer patients get some kind of radiation. Radiation is a huge cause of burning and killing the nerves, and a huge contributor to peripheral neuropathy. And this is out of the Lancet Journal of Oncology. So this information is founded in the literature. Spinal trauma, of course, that's what chiropractors deal with. We deal with spinal injuries to the extremities or the limbs. But again, the good part of that is that if we use this equipment that we are able to use on people and bring them up, we can actually start to heal their nerves. Repetitive trauma, infections, inherited disorders, a small portion, tumors, bone marrow disorders, vitamin deficiency, huge one, chemical toxicity. Glyphosate is everywhere, and now we have forever chemicals. These things get in the body, the liver gets overwhelmed, and it can't get it out of the body enough. It flows around in our tissue, and it damages the delicate tissue at the end of your fingers, at the end of your hands, and in your organs. So we've got to be able to detoxify these things out of the body. We now have an overall system to do this. So again, call McCollum Family Chiropractic, 831-459-9990 to get a preliminary, no charge consultation. Talk to Mariah. She's there right now. Okay. Autoimmune disease. The third most common disease in the US is autoimmune disease. Your body's fighting itself. So this is one of the things that we can help with. Why is your body fighting itself? Don't medicate the symptoms. Of course, I'm not a medical doctor, so if you're on medication, stay on it. But let's find the upstream cause. The only reason you have an autoimmune disease is because your body doesn't know that it thinks it's the enemy. So it's trying to kill itself. Autoimmune, that's what it's doing. So if we get the brain straightened out, we get the toxins out of the body, we start to feed nutrition and oxygen back to the tissue in the tips of the extremities, these things come back. Peripheral nerves are known to grow a millimeter a day. So we should be having Dr. McClimon on here hopefully pretty quickly. Medications, cholesterol drugs, high blood pressure meds, and many more also are contributors to peripheral neuropathy. So if you have the ability to knock that stuff out, then it's going to affect you. I think Dr. McClimon is going to come on in a sec. Doc, you there? All right, man. I really appreciate you being on. Now you're out on the East Coast, correct? Wow, that's amazing. What's it like out there right now? All right. Well, we're enjoying a nice, beautiful day here today. But so at any rate, I've been talking to my clientele about peripheral neuropathy. I'm going to just try something here. Okay, so I don't know that the people on, yeah, the people on Facebook aren't going to be able to hear you on this unless, but that's okay. Maybe I can do this a different way. Try to talk right now and see what happens. Yeah, I can hear you. Okay, for those of you on Facebook, then Dr. McClimon is on KSCO right now. If you tune into 1080 AM or to ksco.com, you can pick up the rest of the show with me and Dr. Dan. We will be able to broadcast this live, and then you'll be able to get the whole show. But Dr. Dan, we are going to continue, and I really appreciate you being here. So I have kind of talked to the people about, the fact that you have been helping doctors around the country learn about these techniques that nobody's doing that actually can help with peripheral neuropathy. And can you just go ahead and introduce yourself? Tell us how you found this and what kind of results you're seeing, because we're seeing amazing results. Yeah, that's amazing. And, you know, when we first started working together, it's only been about 5 months, I think. And when you were telling us some of the success, and our friend Dr. Curtis Martin as well was, you know, just kind of introduced us, and we started talking about what you were seeing, it almost seemed too good to be true for me because, you know, however, we have had really good results with one of the techniques that well, two of the techniques that you introduced. One is, of course, chiropractic, freeing up the nerve impulses, allowing the innate intelligence to communicate with the body is key. But the other thing that we've been adding is what's called the tissue regenerative therapy, or soft wave machine. And that, as you say, it brings in stem cells, it increases blood vessel growth, and it helps your body push out the toxins so that it can heal. You've added a couple more things along with the stem cell machine that's a game changer. The whole is greater than the sum of the parts, and that's what I just tell patients, let alone nutrition that you have from MIT. So maybe dive into that a little bit. Yeah, you know, and that's one thing that was so amazing. A lot of people, a lot of patients have come in and they said, well, I went somewhere and they did something once or twice a week there in the office with light, red light or laser or what have you, or some other kind of thing. And, you know, that's all well and good, but it's not enough. You need to get, like, you know, when you germinate a seed, you can't not water it only once a week. You know, it needs to be nurtured and watered and taken care of, and until it can grow back and be strong and live on its own. And those, as we're regrowing those peripheral nerves, which you've told me, and we've seen it in the literature, can grow a millimeter a day if unimpeded by the toxins and the environmental stressors. So we're going to lessen those as much as we can. But in the beginning, as you were saying, we got to prime the pump. We have to do enough of this often enough and long enough to help those nerves grow and become stable. And we can't do that in the office. People can't come into my office twice a day for 7 days a week for, however long it takes. And that's one of the beauties of what your program is offering. And it's amazing to me. I'm going to just say, listen, you guys are listening, call Mariah, 831-459-9990 right now, 831-459-9990, and we will offer you a complimentary consultation and the thermographic imaging. Maybe you can explain that in a second, Doc, but I know it sounds like an infomercial, and it kind of is, because if you are going to talk about two things people don't do or they miss out, the most important things, and this might be a really good time to talk about that. Yeah, that's such great advice. I mean, just don't wait. If it's nothing's going to hurt you to come in and call Mariah. I'm just going to keep giving the number because she's never there on Saturday. She is today, 831-459-9990. I'm going to just talk about a couple of successes of the patients that we've had. One guy, the neuro questionnaire, I went through this, and out of 25, he had 19 positive things. And he's young. I mean, I don't even think he's in his mid 50s. And he was having so much stuff going on that he was having, he was scared. He couldn't walk. He was, had issues. So he, on the first 3-month recheck, he actually was down to 3 of the symptoms. He had 19 to begin with. He only had 3 after the first 3 months. And some of those went away way before then. Another one of our patients, she may be listening, she's rides horses, right? 100-mile horse rides. She had Centurion or whatever they are, horse rides. That's what she does. And she hadn't been able to ride because of her feet. She couldn't feel her feet in the saddle. I mean, when you're, you know, doing that kind of stuff for love and it's being taken away from you, that's terrible. She told us the other day that she rode for a half an hour with no pain in her feet, first time in 6 months. And she's only been on the program for a couple months. Another woman just talked to her the other day. In fact, she's one of the ones that we have a advertisement of her on the show, on the radio. She just says, my numbness, my tingling is, I didn't even know how bad they were till my feeling came back. So what do you see going on, Doc? You must, with all the docs you work with, and I know you work with docs all around the country teaching them, some of them are my good friends. What do you tell people, or what do you expect when people come in? What are the result percentages on improvement that you see? So absolutely, and I was just thinking, my staff and I, we kind of laugh because when we talk about to our patients on their 3 month or even before, we go, have you been doing both of these like you're supposed to? I probably missed some, We go, man, you're getting results and you're not even doing the program as much as you should. I'm not saying not to, but the reality is probably the day will get in the way and you'll forget to do something here and there, but you can do enough, especially early on, to make a huge difference. I heard from Mariah, we are getting people calling in. We've got a few spots left. So just do it. Just come in, 831-459-9990. We'll have you fill out the neurotoxic questionnaire, neuropathic assessment, basically, and we'll take the pictures. And if nothing else, at least you'll know kind of what your feet look like thermographically. But hopefully we'll be able to give you some good news. So Doc, we've got about 8 minutes left. And one of the things I just love to talk about is the basically it's biofeedback machine. And this thing sends signals from the feet to the brain in the middle ear, 8 times a second. You get passive messages going from your feet up to your brain back and forth. And this is like walking through that field that nobody's ever walked through. And then all of a sudden you keep going through the same area. Pretty soon you have a well-established path. And that's how neuroplasty works. That means that the nerves will regrow. And even they found out now that this will happen in the brain as well. Not that we're necessarily dealing with that potentially, but what we know about the body is it has this amazing ability to heal. You just get out of its way and encourage it. And the greatest physician who ever lives right inside of you. And that's who we are working with. We got brilliance who we're working with, and that's your body's ability to heal. Yeah, absolutely. It's like the body that's, the last thing really to show up is symptoms. You've body's gotten so far along by the time you actually have numbness in your toes or pins and needles or trouble walking. The condition's gone on for a while, just like the person who dies of a heart attack. They weren't healthy the day before with no symptoms, and the next day they had a heart attack. Their body was leading up to that for a long time. They just didn't have symptoms. So we really want to make sure that when you do get these symptoms, it's telling you something's wrong. But the main thing I really want to get out to the people is when we see the lives people get back, most people, a lot of people that have this are in retirement age and they've worked so hard to get there. And now those golden years aren't so golden anymore because they're not able to do the things they wanted to do. I just had a patient tell me she was about to retire and she wanted to go on a 10-day trip to, I think it was Spain or something. She goes, I can't go because my feet are too numb and I'm afraid I'll fall. So we're encouraging her to do what she needs to do to improve that, because I want her to live the life she wants to live. Touch just a second on why the nutrients are, how you develop the nutrients and why those are important. Yeah, and again, the results we're getting from all these techniques are great. And so for those of you that are listening online, or we will have Dan's voice on the last half of the show on the YouTube channel by mid next week, so you can listen to it and see the slideshow that I have going along with it. And Dr. Dan, thank you so much for everything you do. And I really appreciate you jumping on here. And I texted you today and said, hey man, you want to come in and help us help some people? And you were just so willing to help people. I really appreciate your time. Thank you so much. So there's still time to call 831-459-9990. Mariah will be there till about 2:30, but don't hesitate, because you will lose more function. Dr. Dan, thanks so much. We're going to be off, and I'll talk to you soon, my friend. Thanks, and enjoy the snow. Bye.